Hello viewers, and welcome again in another video of Mind and Body Holistic Health Clinic. Today's video is about a very common digestive health disorder, and some of its main symptoms are heartburn, acid reflux, burning sensation in your throat or in your chest as well. And this particular condition that I'm going to give you some basic information today is called GERD, or Gastroesophageal Reflux Disorder. When we eat any food, or when we drink some water or liquids, we have a food pipe which is called esophagus, and it passes through that pipe into our stomach. Once that food is passed down in our stomach, there is a sphincter which is located at upper part of your stomach, and it gets closed straight after eating certain foods as well. But because of many reasons, sometimes there are a lot of factors, and that we can discuss in another video, it becomes very loose. So instead of keeping the food inside your stomach, you have to reflux it back, and it comes back in your esophagus and sometimes in your mouth as well. So that particular condition relating to our esophagus or stomach is called GERD, or Gastroesophageal Reflux Disorder. So I'm going to talk about GERD in very brief today, and also talk about its possible causative factors, what can make it worse, and what are some of the visible or peculiar signs and symptoms. And obviously I'm going to give you some solution at the end as well, that how you can improve your condition, and how you can reverse this condition with some natural and holistic remedies as well. So some of the common signs and symptoms, as I've said, of this condition are acid reflux, heartburn, or water breath as well. Also, some patients, they have worsening of this condition after eating their meals, or changing their posture, or especially while they are lying down. They may also have sour or acidic taste in their mouth as well. Sometimes they have difficulty in swallowing food, which is called dysphagia. And also they feel that something is stuck here. A feeling like something stuck in their throat is another symptom of this condition as well. So they may also have pain behind their breastbone, around their chest as well, feeling sick sometime, and also nausea. And some patients in severe condition, they have green colored vomiting as well, and that is because the color of bile which is in your stomach to help digest your foods as well. They may also have violent cough, hoarseness in their voice. They may also become anemic, and sometimes they have too much unintentional weight loss as well. So these are some of the common signs and symptoms of GERD. Now, what are the possible causes of this condition? Because the thing is, if you can identify the cause of any medical condition, and if you prevent from that, so many health disorders can get better, even taking chemical based or different kind of medicines as well. Because normally when we ask our doctors or GPs, they give us something which suppress our acidic production from our stomach, and that is, I don't think, is the right approach, because you need certain levels of acids to properly digest various types of foods in the stomach as well. So we have to find some alternative or complementary remedies which doesn't disturb your acidic levels, and they can also help you improve these conditions and reverse the problem as well. So these are some of the possible causes. First of all, people who eat a lot of fatty or oily meals, especially people who dine outside in restaurants, and they attend parties a lot as well. So the kind of food we eat can affect your stomach badly, and sometimes it can also affect your sphincter, which becomes loose after some time as well. Also, some infection, like infection in your throat, infection in your stomach, or certain infection of your lungs can also cause this problem as well. Also, because of side effects of certain medicines, they can also loosen various muscles in the body, including the sphincter around your stomach. Obesity, and also it's very, very common during pregnancy as well. Pregnant women, they experience GERD or acid reflux quite a lot as well. Also, it could also be due to a condition which is called hiatus hernia, which is some kind of a swelling or inflammation or bulging in your stomach, and that can also cause GERD quite a lot as well. People with the history of diabetes mellitus, or pyloric obstruction, there is an obstruction here. Also, several foods can also make this condition worse, like eating citrus foods, carbonated beverages, caffeine, chocolate, and especially people who drink alcohol and smoke a lot. So these are some of the triggers which can make this condition worse as well. So definitely, you need to change your lifestyle in terms of eating habits. Also try not to eat anything at least 3 to 4 hours before you go to sleep if you suffer from this condition. So try to eat well before around evening time, and it should be at least 3 to 4 hours before you go to your bed, and avoid definitely large meals, fatty and fried foods as well. Now at the end, as I promised, I will give you some complementary remedies or herbal supplements which can help improve this condition. And if you take these remedies, I'm sure you wouldn't need any supplements which can suppress the production of acidity in your stomach as well. And they can also not only suppress that, they can also leave a lot of side effects if you use them for long. And I'm going to suggest some remedies now. So one of the best herbal supplements, which is called Slippery M. Slippery M is one of the leading remedy for digestive health, especially for acid reflux. It works just like coating in your stomach. So the sensation of burning in your stomach, regurgitation of reflux in your stomach can be very much improved by using Slippery M on daily basis as well. Also need to include more probiotics. You need to balance your gut flora. So probiotics contain a lot of friendly bacteria which can help balance your stomach and also your gut, and that can improve your condition a lot as well. I'm also going to suggest one herbal supplement, a herbal tea, which is called chamomile. So include chamomile, a couple of cups every day. Simple drink this tea in hot or warm water, and it will not only improve your stomach health, but it's also good nervine. It is also very good for your brain function and nervous system as well, because most of our stomach conditions, they are linked with your brain, like anxiety and stresses like IBS, IBD. So if you consider taking chamomile tea with that, that will relieve or calm down your mental health, and that will ultimately improve your IBS related symptoms as well. Also, you should include more aloe vera juice. So simply you can add some fresh aloe vera juice in some water, a glass of water, before you are having your meal. So these are some of the top herbal supplements. Now I'm going to suggest top 3 homeopathic remedies. And if you try homeopathic remedies for a certain time, for say for about 2 or 3 months, you can most likely reverse this condition completely, and you wouldn't get these symptoms in future as well. But definitely you have to look after yourself in terms of dietary intake, and lifestyle is also equally important. So the first remedy in homeopathy is called Calcarea carbonicum or Calcarea carb. So you have to take this remedy as in 30 or 200 potency. And normally, as I've said, homeopathic remedies are available as in drops in the market. So you should ask the chemist to convert these drops into pills. So simply have some unmedicated pills, or you can add yourself few drops of this remedy, and your medicine will be ready. And at the end, you can label and take this remedy 2 to 3 times a day. Especially if you're getting sour taste in your mouth, or sour regurgitation or reflux, the taste is very sour. So Calcarea carb is one of the peculiar remedy for those kind of sensations. The second remedy and the third remedy that can replace omeprazole, lansoprazole, these kind of medicines. So if you consider medicine which is called pulsatilla, either 30 or 200, and you can add another medicine which is called carboveg, which is also either 30 or 200. These two medicines, believe me, can replace your intake of lansoprazole, omeprazole, or any these kind of ranitidine, these kind of tablets as well. So you can consider either Calcarea carb, or you can add as I've said, pulsatilla and carboveg in your daily intake about 3 to 4 times a day, as I've said, in pills forms, and simply let them melt. You don't need water with them. Simply let them melt, and they will improve your conditions. It will not only strengthen your weaker sphincter around your esophagus, but it will also improve your symptoms as well, and you will find a lot of improvement as general in your stomach health as well. So I hope this video would have given you some better insight about GERD and how you can improve that. Also, as while you're lying down, I'll give you a tip that you try to raise your head. Put some pillows, extra pillows under your head, so that can also help relieve this condition as well. If you need any further help or advice, you can always contact me. You can contact me through WhatsApp messaging. My direct number is 07960 299 and I'm based in Birmingham, UK. Otherwise, if you visit my website, you'll find all these medical disorders with drop down kind of sections where you can select your peculiar sign and symptoms, and then we can also suggest more closer remedies to your health as well. So thank you very much for watching, and I will see you again with another topic, and you take care, and bye bye.